Hey guys, what's happening? Dr. Victoria Munoz here, and I haven't been here in a while, so I wanted to come and update you on some things that are going on. Plus, I want to know some information from you. So we're going to start this whole thing out with a survey. And what I want to know is basically what you are looking for in a doctor, okay? I think this is very important because me as a doctor, I know what I have to offer, but I want to know what patients are looking for as well. And part of that is about your doctor's reputation. So first of all, and you can comment below, this is not a formal survey. What do you want in a doctor? Number one, okay? And then next, hold on, I gotta fix my screen here. Do you want to know that your doctor participates or practices what they preach, or do you prefer not to know personal things about your doctor? That's number two, okay? And then do you want to see your doctor in a white coat, like this? And I'm talking like on my website, on these presentations, or like this. So I guess basically what I'm saying is, do you want your doctor to look clinical, or do you want your doctor to be more personable? Okay, obviously I'm not going to wear this to work, but when I do these Facebook Live presentations, I often do wear my sick aesthetics gear because, you know, I'm not a doctor right now. I am, you know, I'm a human being. So that, and then also specifically, do you want to know about my bodybuilding news and sick aesthetic sportwear, or do you just want medicine-related subjects for these kind of presentations? Do you want them to be separate? You know, I can do Facebook Live for, you know, bodybuilding and all, and sick aesthetics, and I could do a separate Facebook Live for medicine, or do you like to see it combined? So I guess those are basically the things that I'm looking for. I want to know what kind of presentation you want from your doctor, what you like to see in your doctor. Do you want to know that they practice what they preach, or do you not want to know anything about the personal life? So I'm not going to comment or say anything more. I'm just going to let you let me know what you think about all that. So let's move on to regenerative medicine. You know, I'm passionate about regenerative medicine. I'm a regenerative medicine specialist, and the question comes up, what is regenerative medicine, all the time? People ask me, well, you specialize in regenerative medicine, what is that? So here's the thing. If you go and you do a Google search on regenerative medicine, the majority of what you're going to see is stem cell and stem cell-like information, okay? Stem cell seems to be the big topic with regenerative medicine, but the thing is that that's not all regenerative medicine is about, okay? Stem cell is like the tip of the iceberg up here, okay? The patient comes in with a torn, you know, rotator cuff, for example, in their shoulder, and let's say after a full evaluation and imaging, we decide stem cell or stem cell type product is, excuse me, the way to go, then we can do that. However, there's a lot more to healing the body than just doing an injection. That's my point in saying that regenerative medicine is more than just a stem cell type procedure. We have to look at the person as a whole. You know, we have to look at chronic illnesses, autoimmune conditions, gut health, and so on. So we'll touch on that a little bit more in a minute. But anyway, regenerative medicine is largely based on stem cell and stem cell type procedures, but as a doctor and as a regenerative medicine specialist, I'm going to tell you that in the field of regenerative medicine, there's more to it than just that. Okay. So in terms of stem cells, there are two different kinds of stem cells, okay? There's multipotent, and these are basically adult stem cells that come from our bodies. They have limited regenerative power. They're basically old cells. If you're 50 years old, for example, Your stem cells are 50 years old, and they're autologous, meaning they come from your own body. So, for example, if a doctor is going to do an autologous treatment, stem cell treatment, to fix that rotator cuff tear, what they're going to do is excuse me, they're going to do a surgical procedure to remove bone marrow or adipose, which is fat tissue, from your body. They're going to process it a certain way, and then they're going to re-inject it into the injury. It's very arduous. The results are not the full result that I would expect to get for my patients. And, you're creating an injury to repair an injury. Personally, I don't do that because even though I had the ability and the opportunity to become trained in autologous stem cell treatments, I chose not to do it after I did my research on the various types of procedures and products that I could use. Now, the second kind of stem cell is called pluripotent. And what these are, they're brand new, like baby-like cells. They don't come from babies, so don't get all worked up there. They're baby-like cells, they're brand new cells, and they have unlimited regenerative potential. These are new cells, and they're donor cells. Okay, so these cells do not come from fetuses. They come from placenta, and they are gleaned from a scheduled C-section placenta. It goes through 3 different testing processes. First, the mother has to agree to donate her placenta to science. Now, she doesn't know what her placenta is going to be donated for, but she knows that she's donating it to science. Okay? So there's a testing process while the mother's pregnant, testing process right after the birth, and then another testing process once the placenta reaches the manufacturer to ensure that there's no diseases and there's no problems with the placenta, the integrity of the tissue is good, and so on. Okay, so now we have it. We have multipotent and pluripotent cells. Okay, and moving on to the different types of stem cell type products, not all stem cells are made equally, okay? So we have what's called cryopreserved or whole cell products, and these products and these companies claim to have so many live cells within their product, okay? This has to be cryopreserved, and so there's the expense of having a cryo tank, plus, it's a very delicate procedure simply because timing is everything. Once you take that stem cell product out of the cryo tank, you have about 15 minutes to inject that into the patient's injury. Now, if there's a delay of any kind, that's going to be a problem with the product, okay? Plus the cost of the cryo tank and maintaining it. And typically these companies you have to buy in ginormous volumes, like $10,000 or more, okay? Then there's the lyophilized product. And what this is it's the proteins. So inside the stem cell, the cell is like this. You have a cell wall, and you have product inside the cell, right? The product inside the cell is typically proteins. And what those proteins are growth factors and cytokines, okay? The cell is just a carrier. So having a live cell to treat a soft tissue injury is not necessary. I'll tell you why. Because, sorry about that. I'll get back to them later. So what happens is, let's see, where were we? Live cells, okay. So when you take these cryopreserved products that have live cells, you inject it into torn rotator cuff, which we're using for an example, and in order to repair that soft tissue, what's going to happen is within 3 days, the cells die and release the proteins and cytokines inside the cells. That's what does the work, okay? It's the proteins, the growth factors, and the cytokines inside the cell that does the regenerative work, okay? So the cell is just a carrier. Now, lyophilized products are the next option. Excuse me. And what this is they take the proteins inside these cells. Okay, they got one thing right. They're taking the proteins. They don't need the cell wall. But what they do is they dehydrate it and they crush it down into a powder and then put it in a vial. And then what the doctor does is comes along, reconstitutes it with sterile saline, and then proceeds to inject it into that torn rotator cuff, okay? Now there's a couple problems with this. First of all, when you dehydrate and crush proteins, it denatures them, so they are not as regenerative as they would be if they were minimally altered, okay? Minimally manipulated. Secondly, you have to use a pretty large bore needle to inject this product because there's a lot of whole pieces in it that, it's not only painful, but it doesn't completely dissolve, and you're going to get probably a very poor result from these products, okay? So then the next option is liquid allograft. Excuse me. Liquid allograft is simply the proteins inside the stem cells, the growth factors and cytokines that what they do is they take the cells, they put them on a medium, they grow the cells. They maximize the growth of these cells. Then what they do is they wash the cells out, and you're left with the proteins, the regenerative proteins, the growth factors and cytokines from the stem cells, and it's a high concentration of these proteins in this product. It's a liquid, and what you do, and these proteins have not been manipulated, okay? They're really easy to draw up. You draw them up, and you inject them into the joint, okay? It's virtually painless for the patient. I mean, there might be some pain just because there may be inflammation in the joint, and there may be other issues with the joint, but the product itself is not painful to inject. Once it's in there, it starts doing its work right away. In fact, it's not uncommon for my patients using this product, which this is a product I use a liquid allograft. It's not uncommon for them to get off the table after procedure and be almost completely out of pain. And this is due to the anti-inflammatory markers within the product that help to reduce inflammation and get the patient out of pain right away. Now, it doesn't mean that that it's fully healed. You know, it takes 3 to 6 weeks to get the full result from this product. But because I have mastered my protocols and know how much product to use depending on the level of injury, one and done. I rarely have a patient needing to come back for a second treatment. If they do have to come back for a second treatment, it's usually a very, very, very severe case, and we just have to do minimal amount just to get them fully healed. So that's the 3 different kinds. We have the cryopreserved, which is whole cell. Then we have the lyophilized, which is dehydrated, crushed, and put into a vial. And then we have the liquid allograft, which is minimally manipulated, whole proteins, high concentration, does amazing, amazing, amazing work. So that's what I use. So, why do we get soft tissue injuries? I mean, what causes these injuries? Well, there's a number of reasons why somebody can have a soft tissue injury. Trauma is one reason. Car accidents, sports injuries, a number of different things that cause traumatic injury to the area. You know when it happened. It was very painful probably when it happened. And, you're gonna, need probably immediate attention to that injury. The second is degeneration over time. And what we see is with age, but also with chronic inflammation in the body. And this could be due to diet. Diet's a large part of it, guys. Diet is huge. Your MD medical doctor is not going to tell you that, that diet is important. In fact, they don't even know how to tell you how to design a healthy diet, okay? So diet, and also other disease processes like diabetes that's not well managed, autoimmune conditions, and so forth, okay? So these are largely things that we have control over, and even as we age, you're going to see a difference in the way that people age, simply because what happens is you could have 2 50-year-olds standing next to each other. One of them, didn't really pay attention to their health. The other one did. And, this one probably will have chronic pain. This one, very little, if any. Okay, so So aging is a part of it, and we all end up with a little bit of arthritis as we age, just because of the wear and tear on our bodies over time. But how bad that arthritis is and how soon you start experiencing it is going to be key in soft tissue injury related to the degenerative effect of lifestyle, diet, and aging, and so forth. Okay, so we're talking about inflammation with aging and chronic illness. There's chronic inflammation, acute inflammation. Let's talk a little bit about that, because when we have a traumatic injury, we have acute inflammation in that joint. When we have degenerative effect of, maybe chronic overuse or, poor diets or just, over time, that's more related to chronic inflammation. Let me explain the difference. So acute inflammation is like a fully running faucet. When you turn the faucet on and it's going full force, it serves a purpose, right? You're getting water to fill a glass or wash a dish or whatever, okay? Wash your hands. You're getting a good effect from that faucet when it's turned on fully. That's acute inflammation. Acute inflammation is necessary to do work to heal the body, and we want that, okay? Now, when we have chronic inflammation, that's like a dripping faucet. When it has like a leaky valve or needs a new washer, it's just dripping. You can't turn it off. It just keeps dripping. It's annoying, and it only does damage to the soft tissue in that area. So chronic inflammation is bad, okay? It doesn't serve any purpose but breaking down soft tissue, because it's too weak to heal, yet it's, it's enough to cause damage to our bodies, okay? So that's the difference between chronic and acute inflammation. And chronic inflammation is largely responsible for these issues that happen in our bodies over time. So controlling that is important, and there's ways that we can do that. And when people come in and they come in to get their bodies healed, we talk about that during our new patient visit. So gut healing, you hear a lot about leaky gut and gut issues, and what is this all about anyway? Excuse me, so sorry. Healing the gut is really important, guys. Majority of us have inflammation in our gut if we haven't done something to actively heal it and maintain it. And so what this means is, so what is leaky gut? So let's just look at the intestines and the lining in the intestines. And what happens is the lining should be solid. Okay, nothing should be able to get through it without going through, a certain mechanism, a metabolic mechanism, to get the food from this side of the body, the nutrients from this side of the intestines to the blood, okay? What happens when you have leaky gut, there's gaps in the gap junctions, and whole food products can travel through the lining, get in the blood, and cause all kinds of problems. Our bodies weren't meant to have whole food products in the blood, and this goes through our body, causes reactions known as allergic type reactions. You might have anaphylaxis, you might have an IgG, which is more of a generalized food sensitivity reaction, or you might have IgA, which is more like affects the mucous membranes, digestion, and everything. So IgE, anaphylaxis, IgG, generalized, IgA, mucous membranes. So these are basically the markers that we look for when we're looking at food and food allergies. So when you have leaky gut, you've got this. When your gut's healed, you have this, okay? So this is what you want. This is what most of us have, all right? Disease starts in the gut. Poor diet, stress, GI conditions such as ulcerative colitis, Crohn's, and so forth. We can heal these. We can treat these effectively and get the patient, fully functioning without symptoms. Leaky gut leads to systemic inflammation. So, when we're talking about that chronic inflammation that's causing the breakdown of our soft tissue and our low back, spine, joints, and so forth, well, Leaky gut. Leaky gut causes systemic inflammation. Systemic inflammation causes chronic inflammation. Chronic inflammation causes disease, causes our bodies to break down, okay? So we've got body-wide inflammation that's leading to this chronic disease. Joint pain can be improved with paying attention to these small details. So if you already have joint pain, chronic low back issues, whatever, a lot of that pain can be managed through diet and proper supplementation. So back pain, joint pain. So what can be done for these things? You know, if you go to your medical doctor, or your MD medical doctor, that is, not your NMD medical doctor, which is who I am. If you go to your MD pain management specialist, here's the road you're going to go down. First, they're going to give you painkillers and muscle relaxants, especially if it's back issues. Okay, go home and rest. They don't do any imaging. They don't do any evaluation. They just give you some medication, send you on your way. Okay. Oh wow, miraculously this isn't helping. So you go back to the doctor and they say, well, you know, since the opioids aren't helping, you know, let's try corticosteroid injections. So they start putting you on a regimen of these injections. They're only supposed to give 3 or 4 a year, but you know what? There's doctors that are given 6, 7, 8 a year, and that is really, really damaging to the body. One is damaging, okay? Sorry about that. I know people are trying to get a hold of me while I'm doing this presentation, but anyway. So, corticosteroid injections. Every time you receive a corticosteroid injection, it breaks down the soft tissue by 5%, okay? Then you get another one and another one, another one. What happens is, over time of getting these corticosteroid injections, you're creating more damage to that soft tissue than you started out with. And guess what? Now you need surgery. Imagine that. So, then you go for surgery. And surgery is never, ever a good fix. It never fixes a problem, okay? What it does is it gives you limited range of motion. You're limited in, especially if, like a lot of the people I deal with are bodybuilders because, you know, I'm in the bodybuilding world. Your lifts, you're not gonna be able to lift as heavy, especially if they replace a shoulder, which is one of the worst joints to replace. And, you know, if you have a hip replaced, you know, squats are gonna be, you know, limited, and your range of motion of the hip, you know, the risk of popping that hip out of place. And knees will never be the same. You're never the same after surgery, guys. And even if they don't do a joint replacement, you know, they put rods and hardware in, and it just pretty much creates more pain than you started out with. After about a year, you might get relief from the, you know, initially. But typically, after a year's time, patients having pain again, worse pain. Now they've got sciatica. Before they just had back pain. Now they've got sciatica. And you know what happens is when you go in for surgery, they're removing soft tissue that was meant to be there to support those structures to begin with. So what do you think's supporting it now? Oh, a metal rod. Well, you know, let me tell you something about that metal rod. It's not going to help. Okay, it's going to just make things worse. So that's kind of the breakdown of you know, the road that you go down when you go see a conventional medical doctor for pain management. They never fix the problem, okay? When you come to a doctor like me, I do a full evaluation. You want a full evaluation by a qualified physician. This is required. And a qualified physician means not just a doctor that went to naturopathic medical school, because just because you graduate medical school doesn't mean that you know how to do regenerative injections or regenerative treatments. There's a whole other training that's required and certification for your doctor that's required to be able to do this, and you want to make sure that they're qualified to do this. So a qualified physician is one who specializes in regenerative medicine and pain management. Be sure they're certified and so forth. And like I said, just because they went to medical school doesn't mean they know how to do these types of procedures, okay? With my patients, always imaging is required, okay? 6 months or newer. for like a low back, I want an MRI that's 6 months or newer, or I'm going to send you for an MRI, okay? Imaging is always required. It tells me as a doctor what I'm looking at, and it shows me the exact areas I need to treat and how to treat it. Also tells me the level of damage, the degree of damage to that area, and how much product I need to use, and so forth, okay? So imaging, MRI, 6 months or newer. And like I said, I may need to order imaging if the patient doesn't have a recent MRI. Okay, so with regenerative injections, stem cell or allograft, stem cell type products are not the only way to go, okay? There are 3 basic types of procedures, solutions that I use depending on what's going on with my patient at the time, okay? So I'm just going to name them off real quick: prolotherapy, PRP, and stem cell. Okay, we're going to use the term stem cell, even though what I use is doesn't have cells in it. It's an allograft, but it comes from stem cells. We're just going to use the word stem cell just for the sake of making it easy. Okay, so prolotherapy is a high concentration dextrose solution that I mix in a certain way with an anesthetic. And what this does is it creates acute inflammation. Remember, that's what we want. We want acute inflammation. It creates acute inflammation to induce healing to that area. So with prolotherapy, I use this for more minor issues like fraying, maybe some minor fraying inside the joint, the beginning of osteoarthritis. Somebody who's relatively young, doesn't have a real severe tear or damage to the area, I'll use prolotherapy. Prolotherapy is a very effective treatment, but it takes about 3 treatments to get the patient out of pain and 6 treatments to see the full restructuring of the soft tissue to that area, okay? Provided we diagnosed it right, we're using the right therapy, 6 treatments, okay? They come in, patient comes about every 4 weeks for an injection till we've done all 6 treatments. And it could vary. I mean, they might only need 4, they might need 8, okay? The next level is PRP. So what PRP is, it comes from your blood. So basically we draw your blood, we spin it down, we draw the PRP up off the top, okay? It's basically the plasma from the blood. It's rich in proteins, and it has growth factors in it, about 20, between 20 and 30 growth factors in your blood. We spin it down so it's concentrated. We inject it into the injury, okay? And it takes 1 to 3 of these treatments, and it's very dependent on the patient's health status, okay? So the patient is very unhealthy, diabetes, it's not well managed, then probably their blood isn't going to be as good as it could be otherwise. So the health status of the patient is really important when we're using their blood. Then the next one, obviously, big guns, stem cell, allograft, liquid allograft. It's a one and done. One treatment, provided you're working with a doctor like myself who has designed protocols that are tried and true and that are very effective in rebuilding, regenerating that soft tissue. One treatment should see a full effect of the healing within 3 to 6 weeks after the treatment. So with allograft, like I said, the patient feels better almost immediately, but they still have to take it easy for about 3 weeks. And then, I obviously recommend that they continue to use the joint. The joint needs to be mobile, okay? Doesn't need to be, immobilized. That's one of the worst things you can do for a joint, because then you end up with, if it's a shoulder, frozen shoulder, for example, okay? But the beauty of the allograft is that it heals. It removes scar. It dissolves scars. So even if it's an old injury, we can still treat it with allograft, and it will dissolve scars, resolve any kind of problems that are in that area, and rebuild it. It's beautiful. I just really love what I do. So how do you know if regenerative medicine is for you? Okay, if you're suffering from any kind of joint pain, back pain, so forth. How do you know that regenerative medicine is for you? Well, like we said, I talked about a qualified physician. You want a physician that specializes in regenerative medicine specifically, okay? So you contact a qualified physician, you ask for a free 15-minute consultation to learn about what they have to offer. So that's one thing I do in my practice. Patients have questions about, oh, what is the stem cell thing? And, I want to learn a little bit more about it. I will spend 15 minutes with you talking to you about a little bit more in detail about how it can help you. But if you want me to diagnose and treat you, that's when you have to schedule a new patient visit. So if you have any questions, I'm happy to do a 15-minute consultation with any of you just to give you more information about regenerative medicine and how it works. And like I said, ensure that your physician is pain management regenerative medicine certified, okay? This is really important, guys. You don't just go to any doctor, and definitely MDs they're not qualified to do these kinds of things. They're not trained to do these kinds of things in medical school. They don't have these kinds of options for them. So you're not gonna find too many MDs that are doing regenerative medicine the way that I do it. There are orthopedic surgeons that do use the allograft before they do surgery. What they'll do is they'll give just enough of the allograft to ensure that the tissue around where they're going to do the surgery is rebuilt and strong, so that when they go in to do the surgery, that they get a better outcome. Unfortunately, what a lot of those patients don't know is that if they gave a little bit more of the allograft, they probably wouldn't need the surgery to begin with. So this is just, they're trained to do surgery. That's what they get paid to do. And so they're going to give just enough allograft to, help rebuild the supporting structures around the joint, so that when they do the joint replacement or surgery or whatever, that they get a better outcome. So, there's some pluses to that. Sometimes surgery is necessary. And there are patients I have to send for surgery, but we always do the allograft in addition, in conjunction with the surgery, because you get a better outcome. Whenever you cut soft tissue, there's going to be a scar that develops. Unfortunately, the integrity of that tissue, once the scar is developed, is about 80% the tensile strength of your original tissue. Now, if you inject the allograft into that area, the scar won't develop. It'll heal fully and beautifully, and you will have full function of that area of your body, that joint or whatever, afterwards. So 15-minute consultation, just kind of a meet and greet. This is what it's all about, and then you can set up a new consultation with your doctor. My new consultations with my patients take about an hour. They're very comprehensive. I spend a lot of time getting to know my patients so that I can better help them. I do screen them for, autoimmune conditions, for, anything that might be causing excess inflammation in their body, because we can do this, right? We can inject this joint, but if you have inflammation system-wide, some of those cells are going to travel away from the injured area to try and heal other areas of the body, because these growth factors, these cytokines, these proteins are programmed to follow inflammation. So we want to make sure that I want to make sure my patient's optimized before I do this, okay? So how much is this going to cost you? I get this all the time. Cost varies depending on the clinic, okay? It can be anywhere from $2,000 to $20,000, okay? I guarantee I'm not charging my patients $20,000 for these treatments. And it really is dependent on the patient, what's going on with them, how much product we need to use, and so forth. And we're talking about stem cell. So, if you are a candidate for PERLA or PRP, that's great. But if you are a candidate for stem cell, myself as a doctor, I try and work with my patients to make it as cost effective as possible to get them the best result that they can hope for. And and this is something we can talk about at our new patient evaluation. After I evaluate the patient and looked at MRI results, so forth, then I can give my patients a better idea of what it's going to cost them and how to move forward, okay? Insurance does not currently cover these procedures. It's all cash pay. Unfortunately, I'm going to be frank with you guys, insurance doesn't cover anything that makes you better, okay? What insurance is going to cover, and people are always grumbling, I hear it all the time, oh, insurance doesn't cover it, well, I'm just going to go get surgery. Okay, look at this, guys. Don't let insurance companies dictate your health outcome, okay? You have doctors like me who are making these procedures as cost effective as possible. I work with my patients, to get them better. And, it's a one and done. You don't have to keep coming back over and over and over again. I've had people that have had 6 back surgeries. What's that all about? Why would anybody need 6 back surgeries? You know why? Because the problem gets worse with every surgery. And they have to go in and they have to do something else. Pretty soon, you've got a crippled individual. That's what you've got, okay? So the outcome, your health outcome, your quality of life is up to you, okay? If you want to have quality of life, you come see me. If you want to do something that insurance is going to cover, you go see somebody that's going to do some kind of a procedure that insurance is going to cover. But I'm going to tell you something right now, that you will not be the same, okay? That you're not going to have the quality of life you'd have if you resorted to regenerative medicine. And I can't emphasize this enough. You know what? Let's just say it was free, okay? If I could do these treatments for free, let's just say it was free, I would still be telling you regenerative medicine is the way to go, okay? All right. So, enough of that soapbox. How can you contact me? I didn't put it in the description, but I'll go back and I'll put my contact information. But you can contact me for a free 15-minute consultation today. You can contact me at 602-429-9561. That is my office number. I do get those messages. I do call my patients back directly. There's not an assistant or anybody that contacts my patients. I contact them. And that number again is 602-429-9561. All right? Or you can go to my website, dr as in Dr. VictoriaMunoz.com, and you can send me an email, send me a message saying that you want to set up a consultation. All right, guys. Thanks for attending. And again, remember that, don't let insurance companies dictate your quality of life, okay? Because anything that's covered by insurance is not going to give you quality of life. Basically, insurance companies and the pharmaceutical companies dictate that whole area of medicine that I'm not a part of. I'm a part of a different area of medicine. It's called naturopathic medicine, and I'm a regenerative medicine specialist. And if you want quality of life, if you want to get better, if you want to have good health, then I'm the doctor you want to come see. So, hey, you guys have a great day, and I'll be back next week for more fun stuff in medicine. Thanks a lot. Bye-bye.